All right, the next question is, what are the benefits and risks of long-acting reversible contraceptives?
So long-acting reversible contraceptives, or LARCs, are methods that people use to prevent pregnancy and control their periods on a long-acting basis. The benefits of them are that once you have obtained the method, then there's very little else that you need to do to maintain it. And that makes it more effective, because birth control becomes less effective the more due to user error, so to speak, the more you have to be responsible for taking a pill every day, or even going and getting an injection or using a condom. Those things make your birth control less effective. So the long-acting reversible contraceptives are very effective in preventing pregnancy. The other beauty of them is that they are, as the name implies, reversible. So while they may last different amounts, varying amounts of time, some from 3 years, some to 5 or 7 years even, it's an individual decision about when that birth control can be stopped. It doesn't have to, you don't have to keep it for the full term that it's available to you. So that's another benefit. They're covered by most insurances, and we do provide all of them at the health center. In terms of risks of the long-acting contraceptives, a lot of that has to do with the actual method that you choose. IUDs, for instance, there's some risks of small risk of uterine perforation during insertion. Doesn't happen very often, but a person should be aware of it. We do use a device to measure the uterus so that we know how far to place the IUD in. There's also a small risk of infection shortly after insertion because the cervix is dilated. But then that lessens after the first 4 to 6 weeks. With Nexplanon, there's a risk of infection at the insertion site. There's some risks of potentially damaging maybe some nerves or blood vessel if it's inserted incorrectly. However, they've changed the insertion site to make that less of a risk. And then in terms of Depo-Provera, the injection that you get once every 3 months, the biggest risk is demineralization of the bones. So we do ask that most women try and keep a high calcium diet or take a calcium supplement during that time. And there's some irregular bleeding as the body is adjusting to it. But with all of these methods, most of the time, the periods do go away for the term of the length of the method's efficacy. I should mention with the IUD and with Nexplanon, there is a slightly increased risk of ectopic pregnancy. Those methods make the inside of the uterus less welcoming to a fertilized egg. And so if you were one of the unfortunate, like 1% of people who had an unplanned pregnancy while using one of the methods, you would be at a higher risk for ectopic pregnancy because that fertilized egg wouldn't want to be implanted inside the uterus. So if you ever thought that you were pregnant or had a positive pregnancy test while you were using one of the LARCs, you would want to make sure that you contacted your provider right away so you could get an appropriate referral to make sure that the pregnancy is in the appropriate place, and then to make decisions about the pregnancy in general.